So now I'd like to ask you about, because I know you attend a lot of conferences, to tell people about all of this, and it links back to the conversation that we put on ASO last year. Can you give a flavour of the type of conferences that you've been attending to talk about this work?
Sure. The focus has been on going to conferences that are related to movement disorders like Parkinson's disease. And so we've been to the World Parkinson Congresses that meet every 3 years or so. We go to the Movement Disorder Society conferences, their annual meetings, as well as the Pan American regional meetings. And I also go to the American Congress for Rehabilitation Medicine conferences. Those are big rehab conferences. We also have been going to some dementia conferences, the Alzheimer's Association of America conference, it's international, and also the Alzheimer's Europe conference, where Erica Donaldson was on our team. So what do we do at those conferences? We have a team presence. We like to have an exhibit table or booth. Sometimes those are given to us for free because we're nonprofits. More often we have to pay quite a high fee for that. And then we train a teacher team to be there with us to talk. Sometimes we also have people living with Parkinson's or dementia or care partners as part of our team speaking to the delegates. And we disseminate information and we talk to the delegates about how Alexander Technique could be recommended for their patients or clients and what aspects it could help them with. And then we also present our research, abstracts and posters. We submit abstracts, and if they're accepted, then we usually have a poster that we make. We stand in front of that poster and talk about to anyone who comes around that during the poster sessions about our work. The main thing we do is collect contact information. That's super, super important. If we don't have that contact information, we can't follow up when we do have an Alexander course in that country or in that town, or to connect those people to an Alexander teacher in that area. Sometimes we're also invited to an oral presentation, which is even more prestigious than a poster. And I got to do that in Helsinki, Finland at the Alzheimer's Europe conference. And that was very moving. We can actually, there's a link we can make to that presentation, and you can see how huge there were like over 70, 80 people in the room, and how we were sort of mobbed afterwards by desperate care partners wanting this kind of work. And then often I'll submit with a team, like at the rehab conference, a team of rehab specialists to talk about different subjects like working with refugees or working with people living with stroke, etc. And I'll be on a panel and present those sorts of presentations. Finally, we are writing up our pilot data, which is just so overwhelming. We have so much data, and writing articles which are going to be published in peer-reviewed journals. Those are both quantitative articles, but also really beautiful qualitative articles, because we did do really in-depth interviews, semi-structured interviews with all of our care partners. So moving and so much information that we gained. And so we are working on that with Emma Wolverson from the University of Hull, who's been involved in some of the ASO care partner discussions, and some of the other research assistants at Rijals University of Idaho. I think that brings us up to date, and I really do encourage other Alexander teachers to join us in going to these conferences and showing up at these symposiums and joining other membership professional organizations besides Alexander ones. The next conference I'm going to, which I mentioned, is the Movement Disorders Society Pan American Conference, which will be in Cartagena, Colombia. And two of the teachers from Boston, Clara Sandler and Anna Furman, who've taken the Alexander for Parkinson's training, are coming with me. They will be at our table, at our exhibit table at the conference, and then we're also staying longer, and I'm going to train them in the Care Partner course. So this is one of the ways that we build community and partnership and teams. So team building is difficult when there isn't funding, when there isn't jobs yet, that we're really moving towards that. But ultimately, the Poise Project hopes there will be jobs for all Alexander teachers all over the world with diverse population. And ideally, when we have this international presence, is that perhaps we could also have nonprofits or charities, the Poise Project UK, the Poise Project France, the Poise Project Ghana, or any other name, it doesn't really matter, so that we can support one another. And Alexander or courses like this could apply for funding, could apply for grants, could apply for donations in all of these international settings.
Mm. What is the plan for the future with this work?
Okay, well, we have big visions and we take little steps, but sometimes those steps move faster and sometimes they move slower. So what we have now is we have these great bodies of replicable programs, both longer courses. The Parkinson's course meets twice a week for 9 weeks, but we have shorter ones that can meet for just a day workshop or a 2-day workshop or a 4-day workshop. And we're trying to train interested Alexander teachers in those workshops and courses. So we want to build up teams, project-based teams that are interested in exploring this idea of replicable programming and see how that can work internationally. So we have now over 100 teachers who have done a rather in-depth training for Alexander Technique for Parkinson's. And so we're trying to see how many of those, and those are all over the world. Some of them are Spanish speaking, French speaking, other languages. So we're trying to see how can we support them and bring both their communities to find partners with them, as well as from the top down, the medical and allied health professionals, so that we can start to disseminate this work. So we have 2 locations where we're going to focus on a regional or international team project. One is the Boston Providence area. We're going to try to integrate our teachers with programs there, with partnerships, and with a training program so that we can intern some of the trainees into this. And then also the big one is in the UK. So, and Erica's helping a lot with that. There's so many teachers in the UK who are interested in both our Parkinson's work and our care partner work. And if we can start to unite them in regional teams to work together with guidance from the Poise Project, I think we can really establish a good international template as well. The problem, and this will be my final thing, is translation. And I don't just mean language. Even translating into something in England is a bit different than doing it in Boston. But translating culturally to working with someone in Uruguay or Mexico from working with someone in Asheville is very, very different. So we have both language translation and cultural translation. So we need people from different cultures and languages to help us with that.
Well, on that note, I think that's a very inspiring place to finish. Thank you so much, Monica, again, for giving us your time to ASO to talk about your work and for inspiring us. And I do think, we're going to hopefully do more on the care partner side of things. We'll be inviting you back to keep us up to date with how you're getting on, so you can inspire us again and get more of us involved, because I think it's a really, really important area of work that we can all get involved in. So thank you again. And
thanks so much. And I do think that, we have so many options now of breaking down barriers for these care partners. We saw that the online and the in-person delivery had very similar outcomes. They're different, the pros and cons to both. But if we really want to reach people in low-income countries, then we're going to need to find creative solutions.
Yeah, and this is a very good start, and it can, as I say, inspire us all to get involved. Hopefully, we'll have a lot of interesting comments and following this blog. So we'll keep an eye out for those. And so, thank you ever so much again.
Yeah, please feel free to get in touch with me with any questions.